Welcome to our channel, where we dive into the untold stories of history, exploring the struggles and survival stories from the past. Tonight, we're diving into one of the most challenging times in London's history, the spread of deadly diseases during the Victorian era. At a time when sanitation was inadequate and medical knowledge was still in its infancy, London was plagued by terrifying diseases like cholera, typhus, and tuberculosis. These diseases would often spread rapidly through the crowded, unsanitary slums, and the people living there had to find ways to survive in the face of these overwhelming threats. We'll explore how these deadly diseases spread, the horrifying conditions that allowed them to thrive, and how people managed to survive in such harsh environments. Before we jump in, make sure to subscribe to our channel and like this video to help us continue bringing you these fascinating stories. Let us know in the comments where you're watching this video from. We love hearing from our viewers all over the world. Now, let's begin our story. Victorian London, a city bustling with life, was a city on the brink of disaster. The rapid expansion during the Industrial Revolution brought people from the countryside to the city in droves, desperate for work in factories, coal mines, and other industrial hubs. By the mid-1800s, London's population had swelled to over 2 million, and the city was struggling to keep up with the demand for housing and infrastructure. With this explosive urbanization, living conditions in the poorer parts of London became horrific. People were crammed into overcrowded slums, with multiple families often sharing small, poorly ventilated spaces. Sanitation was almost non-existent, with waste and sewage flowing openly in the streets, mixing with the water supply. It was in this grim environment that deadly diseases began to thrive, and they spread quickly among the population. One of the most notorious diseases of the time was cholera. This waterborne disease, caused by the bacteria Vibrio cholerae, spread through contaminated drinking water, and it was one of the leading causes of death in London during the Victorian era. Cholera outbreaks were terrifyingly common, with waves of death sweeping through the city at regular intervals. It often began with a violent fever and diarrhea, followed by severe dehydration and eventual death if untreated. The first major cholera outbreak in London occurred in 1831, and by the 1850s, London had seen several devastating epidemics. The spread of cholera was directly linked to the lack of sanitation and the contamination of water sources. In the poorer neighborhoods, where the water supply was often shared by multiple households, the situation was even worse. People were drinking from contaminated wells or rivers, which were often polluted with raw sewage. Despite the fact that cholera was killing hundreds, even thousands of people at a time, medical professionals at the time had little understanding of how it spread. Most believed that diseases like cholera were caused by miasma, the idea that foul smells from rotting waste and filth in the air caused illness. This belief meant that efforts to combat the disease were focused on cleaning up the air, rather than addressing the real cause, contaminated water. As cholera swept through London, public panic ensued. Whole neighborhoods were ravaged by the disease, and bodies piled up in the streets as the death toll mounted. The healthcare system was unprepared to deal with such widespread outbreaks. Doctors were few and far between, and many had limited understanding of how to treat or prevent diseases. The working class was hit hardest, with many living in the most overcrowded and unsanitary conditions, where disease could spread unchecked. Despite the medical ignorance, there were those who fought back. One of the key figures in understanding the spread of cholera was a man named John Snow. In 1854, Snow, a doctor, noticed that a cholera outbreak in the Soho district of London was centered around a single water pump on Broad Street. He famously mapped out the locations of all the cholera cases and discovered that the majority of them had been drinking from that pump. His research and careful study led him to believe that the disease was spread through contaminated water, not the air. While his ideas were met with skepticism at the time, Snow's work laid the foundation for the understanding of germ theory and waterborne diseases. Although John Snow's discovery was groundbreaking, it wasn't until later that his findings led to substantial changes in public health practices. In the meantime, the cholera outbreaks continued, and the working poor were left to fight for their survival. For many, survival meant enduring the harshest conditions and doing whatever was necessary to protect their families. In the worst affected areas, people sought refuge in makeshift shelters, hoping to stay out of the path of the disease. Other deadly diseases also made their presence known during this time. Typhus, another disease associated with poor sanitation, was rampant in the overcrowded slums. Typhus is caused by a bacterium spread by lice and fleas, which thrived in the filthy conditions of the city. Like cholera, typhus spread quickly and took a terrible toll on London's poor population. It often began with fever, severe headaches, and body aches, and it was frequently fatal without treatment. The spread of typhus was also facilitated by the close living quarters of the working poor. Families living in squalid conditions, with poor ventilation and no access to clean water, were constantly exposed to the lice that carried the disease. Medical understanding of typhus was also limited at the time, and it wasn't until later that doctors made the connection between the disease and the lice that infested the dirty clothes and bedding of the poor. Typhus was so widespread in Victorian London that it was referred to as the king of diseases due to the high mortality rate it caused among the lower classes. As the population grew and the city continued to expand, the spread of tuberculosis also became a major concern. This disease, which primarily affects the lungs, is caused by a bacterium called Mycobacterium tuberculosis. It was highly contagious, especially in crowded living conditions, and it thrived in the poor neighborhoods where people lived in close quarters with inadequate ventilation. Tuberculosis was particularly devastating to the working poor, who were already weakened by malnutrition and poor living conditions. The disease spread easily through the air when an infected person coughs or sneezes, and many people were infected without even realizing it until it was too late. Despite these overwhelming health crises, the residents of London did what they could to survive. Many families found comfort in community support, relying on each other for food, shelter, and care. The close-knit communities of the poor often became a lifeline, and people looked out for each other in times of crisis. Charitable organizations, such as the Salvation Army and local parish charities, also began to emerge during this time, providing food, shelter, and medical assistance to those most in need. But despite these efforts, survival was often a matter of luck, and many families lost loved ones to disease. The working poor were left to endure without the medical support and resources enjoyed by the wealthier classes. In the face of widespread suffering, public health reforms began to gain momentum toward the end of the 19th century. The most significant reform came in the form of improved sanitation and the gradual introduction of clean water systems and modern sewage infrastructure. The Great Stink of 1858, when the smell of raw sewage became unbearable in the heart of London, led to a renewed push for sanitation reform. The creation of a new sewage system, led by engineer Joseph Bazalgette, helped to reduce the incidence of cholera and other diseases linked to poor sanitation. Bazalgette's work is often credited with having saved thousands of lives by providing London with the infrastructure it desperately needed. By the time the 20th century dawned, disease control in London had improved, though many of the challenges faced by the poor remained. Public health systems were better equipped to handle epidemics, and advances in medicine led to more effective treatments. However, the legacy of the Victorian-era health crisis remained, and the struggle to provide equitable health care to all continued into the modern era. As we continue our exploration into the deadly diseases that ravaged Victorian London, it's essential to look at the specific outbreaks and how they shaped the scientific and public health advancements of the time. The Victorian era was marked by a series of devastating disease epidemics that took the lives of thousands of Londoners, especially among the working class. Cholera, typhus, and tuberculosis were the most infamous of these diseases, but they were not the only ones that contributed to the public health crisis in the city. Understanding how these diseases spread and the efforts to combat them gives us a clearer picture of how modern public health emerged from the chaos of Victorian London. The first major epidemic that we'll focus on is cholera, a disease that devastated London multiple times during the 19th century. The first outbreak of cholera in London occurred in 1831 with devastating effects. Cholera spread quickly and easily through contaminated water sources, often carried by sewage that found its way into the Thames River, the main source of drinking water for many of London's residents. At the time, There was no understanding of germs or how diseases spread. People believed that cholera, along with many other illnesses, was caused by bad air or miasma. This belief led to ineffective solutions, such as trying to clean the air by burning chemicals or using perfumes to mask foul smells. The second cholera epidemic in 1848 was especially deadly. By this point, London's population had continued to grow, and unsanitary conditions in the slums had worsened. The working-class districts were overcrowded, and sewage systems were primitive at best. This made it easy for cholera to spread rapidly. Whole neighborhoods were decimated, and the death toll reached thousands. But the people were still unaware of the true cause of the disease. It wasn't until John Snow, a pioneering physician, conducted his groundbreaking research during the 1854 cholera outbreak in the Soho district that the theory of waterborne diseases began to gain traction. Snow, who had been studying the pattern of cholera infections, noticed that most of the affected cases were centered around a single water pump on Broad Street. Through meticulous mapping, he proved that cholera was not caused by miasma, but by contaminated water. By persuading authorities to remove the pump's handle, he effectively ended the outbreak in that area. Though Snow's discoveries were not fully accepted by his contemporaries, his work was instrumental in shaping future public health policies. His findings helped to lay the groundwork for the eventual acceptance of germ theory in the late 19th century, and were a turning point in public health history. Following the cholera outbreak of 1854, some changes began to take shape. Sanitation reforms were slow but started to take hold. The city began to take more seriously the need for cleaner water sources, proper sewage systems, and better waste disposal. But the death tolls from cholera continued to rise in the years following Snow's discovery, due in large part to lack of immediate infrastructure and the overwhelming urban population growth. Another devastating disease that struck London during this period was typhus. Typhus, caused by a bacterium spread by lice, was another killer that thrived in the overcrowded, unsanitary conditions of the slums. Typhus was often called the king of diseases due to its ability to wipe out entire communities. The disease was particularly dangerous because it spread quickly in areas where people were living in close quarters and lacked access to clean clothes or bedding. Typhus often accompanied cholera outbreaks, compounding the suffering of the poor. Unlike cholera, however, typhus was more directly linked to personal hygiene and filth. People who lived in filthy, damp conditions, with little access to fresh water or the ability to keep their clothing clean, were at the highest risk. With limited medical understanding, there were few effective treatments for typhus, and many victims simply had to endure the disease until it either ran its course or ended fatally. The Great Irish Famine of the 1840s, which sent a wave of Irish immigrants to London, exacerbated the typhus crisis. The influx of impoverished immigrants who were forced to live in the already overcrowded slums contributed to a further spread of the disease. By the time it reached its peak in London, typhus had become an unstoppable force, leading to thousands of deaths in the slums. While typhus was eventually recognized as being spread by lice, it wasn't until the late 19th century that modern medical understanding would lead to the development of more effective treatments and better preventative measures. In the face of these disease outbreaks, London's medical establishment began to take action. In 1854, in response to the devastation caused by the cholera epidemic, the General Board of Health was established to address public health issues. The board was tasked with investigating the causes of diseases and making recommendations for improving living conditions. Unfortunately, the board faced significant opposition from politicians and other influential figures who were resistant to change, and it was disbanded in 1858 after the passing of the Public Health Act. Nevertheless, the introduction of government-sponsored health reform marked a turning point in the Victorian response to disease. Though the initial reforms were slow, they eventually paved the way for more substantial efforts. The most notable of these efforts came in 1858, with the passing of the Public Health Act, which called for a large-scale overhaul of London's infrastructure. The new system of modern sewers, developed by Joseph Bazalgette, was designed to take sewage out of the streets and carry it to a treatment facility, where it could be properly disposed of. This act led to the creation of one of the most significant public works projects of the Victorian era, which would not only reduce cholera outbreaks but also greatly improve overall public health. Meanwhile, the typhus problem began to subside as the public began to understand more about hygiene and the connection between cleanliness and disease prevention. Public health campaigns started to teach the poor about personal hygiene and the importance of keeping their homes clean, and this knowledge helped to curb the spread of lice and other parasites. As the 19th century drew to a close, tuberculosis became another major concern in London. Known as the White Plague, tuberculosis was a lung disease that spread through the air when an infected person coughed or sneezed. Unlike cholera or typhus, tuberculosis could take months or even years to develop, and it often struck at the working poor who lived in the cramped, poorly ventilated conditions of London's slums. Tuberculosis became one of the leading causes of death in London by the end of the 19th century, and the medical establishment struggled to find effective treatments. It wasn't until the 20th century that the germ theory gained widespread acceptance, and scientists began to understand how tuberculosis spread. The development of treatments, such as the BCG vaccine and later antibiotics, would eventually help to curb the impact of tuberculosis in industrialized nations. Still, during the Victorian era, many of those afflicted with the disease simply had to endure, living in fear of the slow and painful death it often brought. The diseases of the Victorian era were a brutal reminder of the harsh realities faced by the poor in London. Cholera, typhus, and tuberculosis were not just medical challenges. They were reflections of the profound inequality that existed in the city. While the wealthy lived in comfort, the working poor endured the horrors of disease, overcrowded housing, and poor sanitation. And yet, despite these overwhelming challenges, the people of Victorian London found ways to survive. Through the work of brave physicians like John Snow, Joseph Bazalgette, and countless others, the city slowly began to implement reforms that would lead to a healthier future. Though the struggle against disease in Victorian London was far from over, it set the stage for the improvements in public health that would follow in the 20th century. As we continue our journey through the deadly diseases of Victorian London, it's essential to understand the resilience of the people who lived through these difficult times. The poor and working-class residents, who lived in the slums and crowded neighborhoods of London, faced incredible challenges not only from disease, but from the harsh social and economic realities that shaped their lives. While the upper classes had access to better living conditions, medical care, and a greater level of comfort, the working poor often had to rely on community solidarity, survival skills, and a strong will to endure. Despite the overwhelming threat of diseases like cholera, typhus, and tuberculosis, many people in these poorer communities managed to survive, often through sheer determination and resourcefulness. The survival of these communities wasn't simply a matter of luck. It was shaped by their ability to adapt and take care of one another in the face of seemingly insurmountable odds. One of the most striking examples of survival came during the cholera outbreaks of the 1830s and 1840s. When cholera first struck London in 1831, the poor had little to no access to the public health systems that would eventually emerge. As we discussed in earlier parts of the story, the unsanitary living conditions in the slums, combined with the lack of proper sewage systems and clean water, made it almost impossible for people to avoid contamination. Yet despite the fear and panic that cholera caused, there were stories of communities that managed to survive and protect each other through self-help and community action. In the East End of London, one of the areas hardest hit by cholera, residents came together to create informal systems of care. With the absence of adequate medical care, many working-class people had to rely on herbal remedies, home treatments, and the advice of local midwives or folk healers. Charitable organizations also played a crucial role in providing aid to the victims. Churches and parish councils often served as gathering points where people could receive food, clean water, and sometimes even medical attention, although the latter was far from sufficient. In areas like Spitalfields, where the Irish immigrants had settled in large numbers, people would come together to create makeshift hospitals in their homes or in community centers. These spaces were often overcrowded and lacked proper medical equipment, but they provided a sense of solidarity during times of crisis. Community leaders, often volunteers who had little to no formal medical training, would offer their services as best they could, administering simple remedies, offering water to the sick, and helping to care for children who had been left orphaned by the disease. While these efforts didn't stop cholera from claiming the lives of many, they were a testament to the strength of community in times of crisis. The people of Victorian London, especially the working poor, didn't simply wait for help to arrive. They created their own networks of support, taking care of each other when the larger society seemed indifferent to their suffering. These survival networks would form the foundation of much of the social action that followed in the wake of the cholera outbreaks, and they contributed to the eventual public health reforms that sought to eliminate the conditions that allowed such diseases to spread. Typhus, which we discussed in earlier parts of the story, was another disease that wreaked havoc on London's poor. The disease, spread by lice and fleas, was particularly prevalent in the overcrowded and unsanitary conditions of the slums. Families living in tiny, poorly ventilated rooms were particularly vulnerable to typhus, which would spread rapidly through communities that lacked basic hygiene facilities. But, again, survival depended on both individual and collective action. Many working-class families had to cobble together whatever resources they had to survive the worst of these epidemics. Typhus often came hand in hand with poverty and malnutrition, so those who were already weakened by their environment were more likely to succumb to the disease. The poor, however, developed ingenious ways of fighting back. In the absence of any formal medical help, they relied heavily on herbal treatments and home remedies passed down through generations. Garlic, ginger, and peppermint were common herbs used to help treat the symptoms of typhus, though they had little effect on the disease itself. But what these remedies lacked in medical efficacy, they made up for in the comfort they provided. More importantly, self-reliance and community care remained a cornerstone of survival for the working poor. Neighbors helped one another by bringing food and water to the sick, watching over their children, and helping to bury the dead when families were too weak to do so themselves. These collective survival strategies helped the poor endure some of the worst outbreaks of typhus, and in the process, they developed a culture of mutual aid that would continue to define the working class experience in London for years to come. The third major disease of the time, tuberculosis, also known as consumption, was a constant presence in the lives of London's poor. Tuberculosis spread primarily through the air when an infected person coughed or sneezed, and it thrived in the overcrowded, poorly ventilated homes where the working class people lived. Tuberculosis often took a long time to develop, and it was a slow, painful disease. As with cholera and typhus, the poor suffered the most, with children and young adults often bearing the brunt of the disease. But despite the slow pace of medical progress in the Victorian era, people did survive tuberculosis, and many lived with it for years before succumbing to its final stages. Those who had the means could seek medical care, but the overwhelming majority of Londoners lived without access to doctors or hospitals. Instead, they turned to traditional treatments, often herbal and natural remedies, as well as a growing understanding of the importance of fresh air and rest. The belief that the disease could be slowed or halted by moving to the countryside, where the air was fresher and the environment less polluted, became widespread. For those who couldn't afford to leave the city, the best they could do was to make their homes as clean and well ventilated as possible, despite the often oppressive conditions in which they lived. Tuberculosis hospitals began to emerge, but they were limited in number and often only accessible to the wealthier classes. It wasn't until the late 19th and early 20th centuries that modern treatments for tuberculosis, including sanatoriums and anti-tuberculosis medications, began to offer hope for those afflicted by the disease. The survival stories of the Victorian poor weren't just about enduring disease. They were also about surviving the incredibly harsh living conditions that helped spread these diseases in the first place. Public health reforms in the Victorian era, although slow and often resisted by the wealthy, were eventually put in place to improve the living conditions of the poor. Joseph Bazalgette's sewer system, which was completed in the 1860s, was one of the most significant public health projects in the history of London. The London sewage system helped reduce the spread of cholera and other diseases by diverting waste away from the drinking water supply and providing more efficient waste management for the city's growing population. Alongside the development of better sewage systems, improvements in sanitation and clean water supply began to take shape in the late 19th century. Public health campaigns promoted the importance of cleanliness and personal hygiene, leading to a gradual improvement in living conditions for the poor. By the turn of the 20th century, the city's public health infrastructure had dramatically improved, although it would still take many years before the working-class neighborhoods of London were completely free of the diseases that had once been rampant. The survival of the poor during these terrible outbreaks of disease was nothing short of miraculous. Despite overwhelming odds, they managed to endure the worst of the Victorian health crises. Their resilience, resourcefulness, and reliance on community networks allowed them to survive in the face of unimaginable suffering. The medical discoveries and public health reforms that followed the epidemics were crucial in shaping the future of London and eventually led to improved conditions for the working class. Yet, it's the stories of survival from the most vulnerable members of society, the ones who had the least access to medical care and the fewest resources, that stand as a testament to the strength of the human spirit. As we continue our exploration of the deadly diseases that plagued Victorian London, it's essential to focus on the scientific advancements and public health reforms that emerged in response to these devastating outbreaks. These innovations and reforms not only shaped the course of medical history, but also contributed to the eventual improvements in the living conditions of the poor. The struggle to contain diseases like cholera, typhus, and tuberculosis was long and difficult, but the advancements that came out of this period marked a turning point in the fight against infectious diseases. The scientific advancements that began in the Victorian era laid the groundwork for modern public health systems, and these efforts would eventually lead to the dramatic reduction in deaths caused by these diseases. One of the most significant breakthroughs came with the work of John Snow, a pioneering physician whose studies of cholera helped establish the foundation of modern epidemiology. In 1854, during a cholera outbreak in Soho, London, Snow conducted groundbreaking research that would eventually prove that cholera was spread by contaminated water, not by miasma, as was widely believed at the time. Snow mapped out the locations of cholera cases and found a clear pattern linking the disease to a single water pump on Broad Street. By convincing local authorities to remove the handle of the pump, Snow effectively halted the outbreak. His discovery was revolutionary because it demonstrated the importance of clean water in preventing the spread of disease. Although Snow's ideas were met with resistance at the time, his work laid the foundation for the development of germ theory and the modern understanding of disease transmission. Snow's research eventually contributed to the acceptance of germ theory, which would revolutionize medical science and public health. Before the advent of germ theory, diseases were often attributed to bad air, foul smells, or imbalances in the body's humors. However, after Snow's findings, the understanding that specific microorganisms cause diseases became widely accepted, leading to the development of vaccines, antibiotics, and better sanitation practices. Snow's work also helped to pave the way for future medical breakthroughs, including the development of the germ theory of infection by Louis Pasteur and the discovery of antiseptics by Joseph Lister. While scientific breakthroughs like Snow's were crucial in the fight against disease, they alone were not enough to end the devastating outbreaks of the Victorian era. Significant public health reforms were also needed to address the unsanitary conditions that allowed diseases to spread so easily in London. One of the first major steps in this direction came with the passing of the Public Health Act of 1848. This act was a response to the ongoing cholera outbreaks and the general squalor in the city's slums. It created the General Board of Health, which was tasked with investigating the causes of diseases and recommending measures to improve public health. While the board had limited power, its creation marked the beginning of the government's involvement in regulating public health. One of the most important aspects of the Public Health Act was the push for clean water and proper sanitation in London's poorest neighborhoods. These areas, where disease was most rampant, had no proper sewage systems, and waste was often disposed of in the streets or in open gutters. In many cases, drinking water was contaminated by raw sewage, making it a breeding ground for cholera and other waterborne diseases. The government's response was to create more stringent regulations regarding the quality of drinking water and to improve the infrastructure for waste disposal. The sewer system that was developed in response to these needs was one of the largest public works projects in Victorian London. The man responsible for this monumental project was Joseph Bazalgette, a civil engineer whose work would have a lasting impact on the city's public health. Bazalgette's design for London's modern sewer system was groundbreaking. His plan included a series of large, underground pipes that would carry sewage away from residential areas and into the Thames River. While this system didn't completely eliminate the problem of polluted water, it was a significant improvement and helped to drastically reduce the spread of diseases like cholera. Bazalgette's system was not only a triumph of engineering, but also an essential public health reform. It was completed in 1865, and within a decade, cholera deaths in London had dramatically decreased. While the sewer system alone did not eradicate disease, it provided the foundation for the city's growing sanitation infrastructure, and its success was a key factor in the eventual control of cholera outbreaks in London. Another important public health reform in Victorian London was the focus on housing conditions. The rapid urbanization of London during the Industrial Revolution had led to the creation of sprawling slums where overcrowded and unsanitary living conditions were the norm. The poor lived in cramped, poorly ventilated rooms, with little access to fresh air, clean water, or proper waste disposal. These conditions were a perfect breeding ground for diseases like typhus, cholera, and tuberculosis. The government began to recognize that the poor housing conditions were contributing to the spread of disease. In the mid-19th century, several pieces of legislation were passed to improve the quality of housing for the working class. The Artisans and Laborers' Dwellings Improvement Act of 1875 was one of the most significant pieces of legislation aimed at improving housing in London's slums. It allowed local authorities to demolish dilapidated buildings and replace them with new, better quality homes for the poor. While this reform was not perfect, it marked a significant shift in public attitudes toward housing and health. The idea that good housing was a basic human right and that it could help prevent the spread of disease began to take hold. Over time, the development of public housing and improved urban planning would continue to shape the city's growth and its ability to combat the diseases that had once been a scourge of London's poor. In addition to these reforms, the Victorian era also saw the rise of public health campaigns that focused on hygiene, cleanliness, and disease prevention. Public health campaigns were often led by charitable organizations, philanthropists, and medical professionals who sought to educate the poor about the importance of personal hygiene and sanitation. These campaigns included the distribution of pamphlets, the establishment of health education programs, and the promotion of cleanliness in public spaces. As part of these campaigns, the Royal Sanitary Commission was created in 1850 to investigate the living conditions of London's poor. The Commission's report, which was published in 1851, highlighted the squalid conditions in the city's slums and called for improvements in public health and sanitation. The Commission's findings played a crucial role in convincing the government to take more active steps in addressing the public health crisis. By the end of the Victorian era, London had made significant strides in improving public health, but it was still a city grappling with inequality and disease. The sewer system, improvements in housing, and the rise of hygiene education were important steps forward. But the fight against disease was far from over. The impact of the Victorian public health reforms set the stage for the future development of modern public health systems and helped to reduce the spread of infectious diseases in the long run. However, these advances did not come easily. The battle to improve sanitation and combat diseases like cholera, typhus, and tuberculosis required immense public pressure, scientific research, and the tireless efforts of advocates who pushed for change. The people of Victorian London, especially the poor, had to endure immense suffering before these reforms took hold. But through resilience and community action, the working class was able to survive and lay the foundation for a healthier, more equitable society. As we continue our exploration of the Victorian health crisis, it's important to understand the long-term effects of the public health reforms that were implemented in response to the deadly diseases that plagued London. The reforms that began to take shape in the mid-19th century had a profound impact on the development of modern medicine, urban planning, and public health systems in the 20th century. These early efforts in combating disease not only transformed the living conditions of the working poor, but also laid the groundwork for a global health revolution that would eventually change the way we live today. While the immediate effects of the reforms were felt in London, they would also have a ripple effect that influenced public health practices around the world. The Victorian public health movement, although often limited in scope and facing resistance from various quarters, represented a pivotal moment in the development of the modern state's role in managing public health. The efforts to combat cholera, typhus, tuberculosis, and other deadly diseases directly contributed to the creation of health infrastructures and a new approach to sanitation, disease prevention, and healthcare access that would have lasting impacts for generations to come. One of the most significant long-term effects of the Victorian public health reforms was the advancement of medical science. The germ theory of disease, which gained acceptance in the second half of the 19th century, was the result of the groundwork laid by figures like John Snow and Louis Pasteur. Prior to the acceptance of germ theory, diseases were widely believed to be caused by bad air or imbalance in the body's humors. The understanding that specific microorganisms caused diseases was a revolutionary breakthrough in medical science. Snow's research on cholera, which showed that the disease was spread through contaminated water, was a crucial turning point in the development of epidemiology. At the same time, Pasteur's experiments in bacteriology demonstrated the role of microbes in causing infections, leading to the development of vaccines and antiseptics. As the scientific understanding of diseases advanced, so did the development of medical treatments. The germ theory of disease helped to shift the focus of medicine from treating symptoms to targeting the underlying causes of illness. In the decades following the Victorian era, this would lead to the development of vaccines, antibiotics, and antiseptic surgery, all of which would dramatically reduce mortality rates from infectious diseases. The development of the smallpox vaccine and the discovery of penicillin in the early 20th century were direct outcomes of the scientific advances that began in the Victorian period. In addition to the scientific advancements, the public health reforms of the Victorian era contributed to the rise of modern medical institutions. The establishment of hospitals, particularly those focused on infectious diseases, helped to provide care for the growing population in London and across the world. The founding of institutions like the London School of Hygiene and Tropical Medicine in 1899 and the Royal Sanitary Institute in 1857 marked important milestones in the development of public health education. These institutions trained a new generation of doctors, nurses, and health workers who would go on to play key roles in improving public health across the globe. The public health infrastructure that emerged in Victorian London also had a significant impact on urban planning. The rapid industrialization of London and the associated overcrowding in the city's slums had created a perfect storm for disease. The lack of sanitation, poor housing conditions, and inadequate water supply were the primary contributors to the spread of diseases like cholera, typhus, and tuberculosis. The Victorian response to these problems was to rethink the design and layout of cities, to ensure that they were cleaner, healthier, and better equipped to handle a rapidly growing population. The most significant urban planning reform was the creation of a modern sewer system. The sewer system designed by Joseph Bazalgette was a groundbreaking project that fundamentally changed the city's infrastructure. By constructing a network of large underground pipes to carry sewage away from residential areas and into the Thames River, Bazalgette helped to eliminate the most immediate source of cholera and other waterborne diseases. This sewer system became the backbone of modern sanitation in London and was a model for other cities around the world. Bazalgette's work demonstrated the importance of integrating public health into urban planning, and his legacy lives on in the design of cities today. Alongside the sewer system, public health reforms also called for the development of green spaces, better housing, and improved public sanitation. The establishment of public parks and the creation of open spaces in urban areas were a direct result of the Victorian focus on improving living conditions. These green spaces provided residents with access to fresh air and recreation, and they also helped to reduce the impact of pollution in rapidly industrializing areas. At the same time, public health reforms led to the creation of better quality housing for the poor, with better ventilation, sanitation, and access to light. These reforms slowly improved the quality of life for London's working-class population, and they provided a blueprint for future urban development. By the late Victorian era, the city's public health system had significantly improved, but the long-term impact of these reforms extended far beyond the City of London. The success of these early public health measures became a model for other industrialized nations, particularly as cities around the world grappled with similar health crises. The growing recognition that sanitation, clean water, and disease prevention were key to public health led to the spread of these reforms to other major cities in Europe, the United States, and beyond. In the United States, the influence of Victorian public health reforms was particularly evident in the development of municipal sanitation systems. New York City, for example, implemented large-scale sewer systems and water filtration systems in the early 20th century, modeled after the successful initiatives in London. Similarly, public health campaigns focused on cleanliness and hygiene spread across the globe. The World Health Organization, WHO, founded in 1948, built on these early efforts by focusing on the importance of clean water, nutrition, and disease prevention in creating a healthier world. However, despite these impressive gains, health inequality continued to persist throughout the world. While the public health reforms of the Victorian era laid the foundation for the modern welfare state, they were not a complete solution to the problems of urbanization, poverty, and disease. The working class, despite improvements in sanitation and housing, continued to face challenges related to poor nutrition, overcrowded living conditions, and limited access to healthcare. These ongoing issues highlighted the need for continued reform in the 20th century as new diseases and health challenges emerged. The fight against disease in Victorian London was a long and painful battle, but it ultimately led to the birth of modern public health systems. The scientific breakthroughs of figures like John Snow, Louis Pasteur, and Joseph Bazalgette, along with the growing awareness of the need for sanitation and disease prevention, helped shape the trajectory of public health in the 20th century. The legacy of these reforms can be seen in the development of modern healthcare systems that continue to prioritize the control of infectious diseases, the importance of sanitation, and the promotion of health through education and infrastructure. The Victorian public health movement demonstrated the power of collective action, the importance of science and innovation, and the need for government intervention to create a healthier, safer society. While many challenges remain, the reforms of the Victorian era were a vital step toward creating a world where health was recognized as a right rather than a privilege. As we continue to explore the transformative public health journey that began in Victorian London, it's essential to examine how the public health reforms and scientific advancements made during the 19th century spread beyond the confines of the city and into global health initiatives. The reforms in sanitation, water supply, and disease prevention that began in London were not only revolutionary for the city, but also paved the way for the emergence of modern medicine and public health systems worldwide. The changes that occurred in Victorian London served as a blueprint for cities across the globe grappling with similar problems caused by industrialization, overcrowding, and disease. As cities worldwide grew, the insights gleaned from London's early public health efforts helped shape the trajectory of global public health movements throughout the 20th century. While much progress had been made, the 20th century also introduced new health challenges, many of which arose as a result of the very advancements in medicine and technology that were shaping the world. The global spread of public health reforms began in earnest in the latter half of the 19th century, particularly after the success of Joseph Bazalgette's sewer system in London. This system not only saved countless lives, but also became a model for cities worldwide. As urban populations grew, the spread of infectious diseases continued to be a pressing concern, and many cities began to invest in their own sewer systems and water filtration systems inspired by London's reforms. The idea that sanitation and clean water were essential to controlling the spread of diseases was a revolutionary concept at the time. As cities in the United States, Europe, and other parts of the world grew, cholera, typhoid, and other waterborne diseases remained a constant threat. The success of London's public health reforms provided a tangible solution to these threats, leading to the adoption of similar infrastructure projects in other cities. In New York City, for example, public health leaders began to implement modern sewage systems in the late 19th century, inspired by the successes of London's sewage reforms. The idea that waste removal and clean water were directly linked to public health spread to cities across the United States and Europe. Many cities began to invest heavily in clean water sources and improved waste management systems to reduce the spread of disease and improve the quality of life for their citizens. Simultaneously, scientific knowledge about the germ theory of disease began to spread rapidly. In 1876, Louis Pasteur and Robert Koch helped prove that specific microorganisms were responsible for various diseases, including tuberculosis and cholera. This scientific breakthrough revolutionized the medical community's understanding of how diseases spread and led to vaccines, antiseptic techniques, and other treatments that would change the course of medicine forever. The 20th century witnessed a number of new health challenges, many of which were directly linked to the rapid advances in industrialization, technology, and urbanization. While public health reforms continued to make progress, new diseases, influenza, HIV/AIDS, and antibiotic-resistant bacteria presented new threats that had to be addressed. The global nature of modern travel allowed diseases to spread more quickly than ever before, and the increasing reliance on antibiotics and vaccines raised concerns about overuse and the potential development of drug-resistant infections. In the early 20th century, one of the greatest successes of modern medicine came with the eradication of smallpox, one of the deadliest diseases known to humankind. Smallpox had plagued humanity for thousands of years, killing millions of people. However, after the development of a vaccine by Edward Jenner in 1796 and its widespread use during the 20th century, the World Health Organization, WHO, launched a global smallpox eradication campaign in 1967. This campaign, which focused on vaccinating the global population and isolating outbreaks, was declared a success in 1980 when smallpox was officially eradicated. This global victory in the fight against smallpox demonstrated the power of vaccination and global cooperation in the battle against infectious diseases. It also set the stage for future public health initiatives, including the global fight against polio, malaria, and HIV/AIDS, which became major challenges in the latter half of the 20th century. However, as public health systems evolved and more diseases were brought under control, new challenges arose. One of the most pressing issues in the 20th century was the rise of chronic diseases, many of which are directly linked to modern lifestyle choices, such as diet, exercise, and tobacco use. The rise of cardiovascular diseases, diabetes, and cancer in the second half of the century shifted the focus of public health from infectious diseases to lifestyle-related diseases. As the world became more industrialized, many of these chronic conditions became prevalent in developed countries and began to emerge in developing nations as well. The global rise of obesity, particularly in developed nations, has been one of the most significant public health issues of the late 20th and early 21st centuries. The widespread consumption of processed foods, sugary beverages, and high-calorie diets, combined with a more sedentary lifestyle, has led to a dramatic increase in obesity rates, particularly among children. Obesity, in turn, is linked to an increase in diabetes, heart disease, and other chronic illnesses. These trends have prompted governments and public health organizations to focus on preventing lifestyle-related diseases, encouraging people to adopt healthier diets and more active lifestyles. The challenge of combating chronic diseases has also highlighted the growing importance of mental health. As the world has become more fast-paced and stressful, there has been a rise in mental health conditions such as depression, anxiety, and stress-related disorders. In response, public health efforts have begun to place a greater emphasis on mental well-being, advocating for better access to mental health services and promoting mental health awareness. While the 20th century introduced new public health challenges, it also witnessed the continued evolution of the global health landscape. The creation of the World Health Organization, WHO, in 1948 marked a major step forward in international cooperation to address global health issues. The WHO's work in promoting vaccination, disease prevention, and health education helped to reduce the burden of infectious diseases worldwide. The organization also became a leader in addressing health inequities, particularly in low-income countries, by providing technical assistance, funding, and expertise. The global spread of infectious diseases, including the HIV/AIDS epidemic that began in the 1980s, demonstrated the interconnectedness of the world's population and the importance of international collaboration in addressing global health threats. The rise of antiretroviral therapies, ART, for HIV/AIDS along with awareness campaigns and prevention efforts, has helped to reduce the global impact of HIV/AIDS, though the disease remains a significant health challenge in many parts of the world. The rise of global travel, the interconnectedness of the world's population, and the increasing migration patterns of people have all contributed to the rapid spread of infectious diseases such as influenza, SARS, Zika, and, more recently, COVID-19. The COVID-19 pandemic highlighted the ongoing challenges in controlling diseases in an increasingly globalized world. The pandemic demonstrated the vulnerabilities of global public health systems, but also underscored the importance of cooperation and advances in science, such as the rapid development of vaccines to combat the virus. In summary, the public health reforms of the Victorian era, though initially focused on diseases like cholera, typhus, and tuberculosis, set in motion a series of scientific advancements and public health practices that have shaped the way we approach health today. The progress made in sanitation, disease prevention, and medical science during the Victorian period laid the foundation for the modern health systems that have transformed the global health landscape. While infectious diseases were the focus of the 19th century, the 20th century saw the rise of new challenges, including the growing burden of chronic diseases, mental health issues, and the ongoing need to address global health inequities. The future of public health will undoubtedly involve continuing to combat these challenges while maintaining the global cooperation and scientific advancements that have shaped the trajectory of health over the last century. As we move further into the 20th and 21st centuries, the influence of the public health reforms that began in Victorian London continued to shape the global health landscape, especially in developing countries. While much of the progress in public health was initially seen in industrialized nations like Britain, the impact of those reforms eventually spread to colonial territories and later to newly independent countries. The progress in sanitation, disease prevention, and the establishment of healthcare systems in these areas was vital in shaping the global health systems we see today. In many ways, the Victorian public health reforms, particularly the efforts to combat cholera, typhus, and tuberculosis through improved sanitation and clean water systems, provided a blueprint for global health initiatives. The challenges faced by developing countries in the 20th century were often similar to those encountered in Victorian London. However, the scale of these problems was often far greater due to overpopulation, poverty, and political instability in many regions of the world. As colonial powers expanded in the 19th and early 20th centuries, healthcare systems were often established to protect the interests of colonizers rather than the local populations. In many cases, colonial health systems were designed to control the spread of disease among European settlers rather than to provide adequate care for the indigenous people. Health disparities between colonizers and the colonized were stark, with the local populations often suffering from poor nutrition, lack of clean water, and poor living conditions. After World War II and the subsequent decolonization period, many newly independent countries in Africa, Asia, and Latin America were faced with the task of building national health systems that could meet the needs of their poor and often rural populations. Public health reforms became a key component of the development agendas of many newly independent nations. These countries, like India, China, and Brazil, recognized that improving sanitation, nutrition, and disease prevention were critical to their social and economic development. One of the key achievements of public health in the mid-20th century was the eradication of smallpox. The global smallpox eradication campaign, led by the World Health Organization, WHO, was an extraordinary success. The campaign involved mass vaccination programs, surveillance systems, and targeted interventions in remote regions, where smallpox was still active. By 1980, smallpox was officially declared eradicated, marking a major milestone in global public health efforts. The success of this campaign proved that global cooperation and the application of scientific advancements could lead to the eradication of an infectious disease, which had once been a major global killer. The smallpox eradication program was particularly important for developing countries, where the disease was still prevalent and disproportionately affected the poor. The success of smallpox eradication served as a model for future global health initiatives, including efforts to combat polio, malaria, and measles. These campaigns used similar strategies of vaccination, surveillance, and education, and they aimed to eliminate preventable diseases in the poorest regions of the world. Another significant public health reform that affected developing countries was the promotion of sanitation and clean water. The WHO's efforts to provide clean water and improve sanitation in low-income countries became a central focus of its mission in the 1960s and beyond. Many developing countries, particularly those in sub-Saharan Africa and South Asia, faced severe challenges related to dirty water and poor sanitation, which contributed to the spread of diseases like cholera, dysentery, and typhoid. These diseases were particularly dangerous for children and could be prevented with access to clean water and proper sanitation infrastructure. The Water and Sanitation Program, WSP, launched by the WHO and other international organizations in the 1970s, was instrumental in addressing these issues. The program focused on providing low-cost solutions for clean water and sanitation in rural areas, where access to public health infrastructure was often limited. Simple interventions, such as hand-washing campaigns, the promotion of latrines, and the distribution of oral rehydration salts, ORS, for treating dehydration from diarrhea, led to significant reductions in mortality rates from waterborne diseases. These programs also help to improve public awareness about hygiene and disease prevention, empowering local communities to take control of their health. As global awareness of the importance of sanitation and water grew, international organizations such as the United Nations and the World Bank began to invest more heavily in health infrastructure in developing countries. These investments contributed to the improvement of health systems and the reduction of preventable diseases. In particular, the provision of clean drinking water and the construction of sanitation facilities were recognized as critical factors in the improvement of public health outcomes in the developing world. As the 20th century progressed, however, new challenges began to emerge. While infectious diseases were still a major threat, non-communicable diseases, NCDs, such as heart disease, diabetes, and cancer, began to increase in prevalence, particularly in urban areas. These diseases, often linked to lifestyle choices such as poor diet, lack of physical activity, and tobacco use, became more common in developing countries as they became more industrialized and westernized. The rise of these diseases posed a new public health challenge for countries that had once been focused on combating infectious diseases. In response, the World Health Organization and other international health bodies began to focus more on chronic diseases and health promotion. The global strategy on diet, physical activity, and health, adopted by the WHO in 2004, sought to address the rise of NCDs through public health campaigns promoting healthy eating, exercise, and smoking cessation. These initiatives aim to reduce the global burden of chronic diseases, particularly in developing countries, where the shift to processed foods, sugary drinks, and sedentary lifestyles was becoming more common. At the same time, global health initiatives began to focus on the mental health crisis. As cities grew and populations became more stressed by the pressures of modern life, mental health issues such as depression, anxiety, and stress-related disorders began to rise. These issues were particularly prevalent in urban areas, where people were often isolated, faced economic insecurity, and lived in stressful environments. In response, the WHO and national governments began to focus on mental health as a key component of public health, advocating for mental health awareness, access to care, and the reduction of stigma surrounding mental illness. The rise of globalization in the late 20th and early 21st centuries has had a profound impact on public health in developing countries. As travel and trade have increased, diseases that were once confined to specific regions have spread across borders more easily. The HIV/AIDS epidemic of the 1980s and 1990s is a prime example of how global interconnectedness can facilitate the spread of diseases. HIV, which originated in sub-Saharan Africa, spread rapidly to other parts of the world, particularly through global travel and the movement of populations. The epidemic highlighted the need for a global response to health crises, one that included prevention, treatment, and education. Similarly, the COVID-19 pandemic, which emerged in 2019, demonstrated the vulnerability of a globally interconnected world to infectious diseases. The pandemic affected every country on the planet, but its disproportionate impact on developing countries showed how health disparities remain a major challenge. The response to COVID-19 demonstrated the importance of global collaboration, with countries working together to develop vaccines and implement public health measures to curb the spread of the virus. Yet, it also underscored the need for equitable access to healthcare, particularly in low-income countries that lacked the resources to adequately respond to the crisis. As we look ahead to the future, the challenges of public health in developing countries will continue to evolve. The fight against infectious diseases like malaria, HIV/AIDS, and tuberculosis is far from over. But new threats are emerging, including non-communicable diseases, mental health disorders, and health impacts from climate change. The progress made in public health since the Victorian era has laid the foundation for continued advancements, but the work is far from finished. The lessons of the past, particularly the importance of sanitation, vaccination, and global collaboration, will continue to shape the fight for better health outcomes worldwide. As we step into the 21st century, the landscape of global public health is being reshaped by rapid advancements in technology and scientific innovation. From telemedicine and genomics to artificial intelligence, AI, and big data, technological innovations are providing new opportunities to improve healthcare access, diagnosis, treatment, and prevention. The progress made in public health since the Victorian era, spurred by scientific breakthroughs and public health reforms, has paved the way for these cutting-edge tools to revolutionize the way we approach global health challenges. However, as we continue to integrate these technologies, we must also consider the ethical, equitable, and global implications they bring. One of the most significant technological advancements in the last few decades is the rise of telemedicine, which is transforming the way healthcare is delivered. Telemedicine, the use of telecommunications and digital platforms to provide medical services remotely, has had a profound impact on improving access to care, particularly in remote and underserved areas. The development of telehealth services has made it possible for people in rural or isolated regions to consult with doctors, receive diagnoses, and even access prescriptions without the need for physical visits to a healthcare facility. In the context of developing countries, telemedicine has played a critical role in overcoming barriers to healthcare, such as limited healthcare infrastructure, shortages of medical professionals, and geographical distance. For example, in many regions of Africa and South Asia, where access to medical care is often limited to urban centers, telehealth platforms are bridging the gap by connecting local health workers with specialists in urban areas or even abroad. These platforms facilitate remote consultations, diagnostic services, and health monitoring, empowering healthcare providers to offer care to patients who would otherwise have no access to medical services. The global COVID-19 pandemic further accelerated the adoption of telemedicine, as many healthcare systems faced overwhelming pressure to provide care while minimizing the spread of the virus. Virtual consultations became the norm, not just for general health concerns, but also for mental health services, chronic disease management, and post-surgical care. As telemedicine continues to evolve, it has the potential to be integrated into health systems on a broader scale, improving healthcare delivery in the global south, where health infrastructure remains underdeveloped. The promise of telemedicine lies not only in its ability to expand healthcare access, but also in its potential to improve efficiency and reduce healthcare costs. By providing remote consultations and follow-up care, telemedicine reduces the need for in-person visits, which can be costly and time-consuming. Furthermore, it can help alleviate pressure on overcrowded hospitals and clinics, especially in low-resource settings. Another game-changing development in modern medicine is the rise of genomics, the study of genes and their functions. Genomics has made it possible to analyze an individual's genetic makeup, identify genetic predispositions to diseases, and develop personalized treatments that are tailored to each individual's genetic profile. This rapidly evolving field is revolutionizing disease prevention, diagnosis, and treatment, particularly in the areas of cancer, genetic disorders, and infectious diseases. The impact of genomics on global health cannot be overstated. In developing countries, the ability to diagnose and treat genetic disorders early has the potential to significantly reduce the burden of diseases like sickle cell anemia, thalassemia, and cystic fibrosis, diseases that disproportionately affect certain populations. Genetic testing can identify individuals who are at risk for these conditions, allowing for early interventions and preventative measures that can save lives and reduce healthcare costs. Moreover, Genomics is playing a pivotal role in the development of targeted therapies for diseases like cancer. Advances in precision medicine are allowing doctors to tailor treatments based on the specific genetic mutations present in a patient's tumor. This has resulted in more effective treatments for certain types of cancer, with fewer side effects compared to traditional treatments like chemotherapy. As the field of genomics continues to advance, it holds the potential to revolutionize cancer treatment on a global scale, offering hope for patients in both developed and developing countries. Genomics also plays a critical role in the fight against infectious diseases. By sequencing the genomes of pathogens like HIV, malaria, and tuberculosis, researchers can gain a deeper understanding of how these diseases evolve and develop resistance to treatments. Genomic surveillance is already being used to track outbreaks of diseases like Ebola, Zika, and COVID-19, providing real-time data on the genetic variations of the virus, which helps inform vaccine development and treatment strategies. The integration of artificial intelligence, AI, and big data into public health systems is another significant advancement that promises to revolutionize global healthcare. AI and big data can analyze vast amounts of health data to predict trends, identify potential outbreaks, and develop effective interventions. This technology can be used to track epidemics, predict disease outbreaks, and even provide real-time feedback on the effectiveness of public health interventions. In developing countries, where data on disease trends may be limited or incomplete, I can help fill the gaps by analyzing data from a variety of sources, such as hospital records, mobile health apps, and social media platforms. By identifying patterns in the spread of diseases, I can help healthcare providers predict where an outbreak is likely to occur next and allocate resources more efficiently. Additionally, AI-powered tools are being used to improve the accuracy of diagnostic tests, particularly in resource-limited settings where access to sophisticated medical equipment may be scarce. For example, in India, AI has been used to analyze medical images to help detect tuberculosis and diabetes more accurately. By utilizing AI algorithms to analyze chest X-rays and other medical scans, healthcare providers can quickly identify potential cases and begin treatment faster. This has been particularly beneficial in rural areas where access to trained radiologists may be limited. The use of big data also allows for the creation of more accurate epidemic models. By analyzing data on population movement, climate conditions, and disease transmission rates, public health authorities can develop better predictive models to forecast the potential spread of diseases like malaria or COVID-19. These models can help governments and health organizations prepare for future outbreaks and allocate resources accordingly. While the technological advancements discussed here offer exciting opportunities to improve global health, there are still significant challenges to overcome. One of the most pressing issues is the digital divide, the gap between those who have access to the latest technologies and those who do not. In many parts of the world, especially in low-income countries, access to the internet, mobile phones, and other digital tools is limited. This means that telemedicine, genomic testing, and AI-powered health tools may not be accessible to those who need them most. To ensure that technological advancements in public health benefit everyone, efforts must be made to expand digital infrastructure, train healthcare workers, and ensure equitable access to healthcare technologies. This includes investing in telecommunication networks, providing mobile health services to underserved regions, and ensuring that genetic testing and medical data are available at affordable prices. Another challenge is the ethical considerations associated with technologies like genomics and AI. As we begin to use genetic data to predict disease and develop personalized treatments, questions about privacy, data security, and genetic discrimination arise. Similarly, the use of AI in healthcare raises concerns about the potential for bias in algorithms, which could exacerbate existing health inequalities. It's essential that ethical guidelines and regulations are put in place to protect individuals' rights and ensure that these technologies are used for the greater good. Finally, there is the challenge of global health coordination. While technological innovations offer tremendous potential, they can only be effective if global health systems work together to implement them. This requires collaboration between governments, international organizations, and private sectors to ensure that new technologies are deployed in a way that benefits all populations, particularly those in developing countries. In conclusion, the rise of telemedicine, genomics, and AI is reshaping the future of global health. These technologies have the potential to improve healthcare delivery, diagnosis, and treatment in ways that were unimaginable just a few decades ago. However, as we move forward, it's important to address the challenges of access, equity, and ethics to ensure that the benefits of these advancements reach everyone, regardless of location or income. The legacy of Victorian public health reforms, which laid the groundwork for modern sanitation systems and medical advancements, continues to influence global health today. As we look to the future, the integration of technology with public health efforts will continue to shape the trajectory of global healthcare, offering new opportunities to combat infectious diseases, chronic conditions, and mental health disorders. Good night, and thank you for joining us of this fascinating journey through the history of public health. We've explored the role of technology in reshaping global health systems. Don't forget to subscribe, like the video, and leave a comment below on where you're watching from. We look forward to continuing this journey with you. Welcome to our channel, where we slow history down and gently explore the forgotten systems, routines, and lives that shaped the modern world. Tonight, we begin a long journey into how crime and punishment worked in Victorian London, from the earliest forms of policing to the grim realities of courts, prisons, and public justice. This story will unfold gradually, revealing how fear, poverty, order, and control shaped everyday life in one of the largest and most unequal cities in history. You'll hear about criminals and constables, laws and loopholes, punishment and survival, all woven into the rhythm of Victorian London. Before we go any further, take a moment to subscribe to our channel and like this video. It helps us continue creating long, calm history stories like this one. And please comment below from which location you're watching. We truly enjoy reading where our listeners are joining us from around the world. Victorian London was a city of sharp contrasts. Grand buildings and gaslit streets stood beside dark alleys and overcrowded slums. Wealth and poverty existed side by side, and where poverty thrived, crime followed closely behind. For many Londoners, crime was not driven by greed or malice, but by hunger, desperation, and the constant struggle to survive. Stealing food, clothing, or coal was often a matter of necessity rather than choice. Yet the law did not always see it that way. The Victorian legal system was strict, moralistic, and often unforgiving, shaped by the belief that order must be maintained at all costs. At the beginning of the Victorian era, London did not have a professional police force as we understand it today. Law enforcement was fragmented and inconsistent. Night watchmen patrolled certain areas, often elderly men with little training, more likely to nap than to chase criminals. Parish constables existed, but they were usually unpaid or poorly paid, and many lacked motivation or authority. Crime was handled locally, unevenly, and often inefficiently. This lack of structure allowed theft, violence, and disorder to flourish, especially in densely populated areas. The city itself was a breeding ground for crime. London's population exploded during the Industrial Revolution, swelling with migrants from the countryside seeking work. Housing could not keep up. Families crowded into single rooms, sanitation was poor, and disease spread easily. In these conditions, theft was common. Pickpockets worked busy markets and streets. Burglars targeted homes at night. Gangs formed in poorer districts, especially among young men and boys, who saw crime as their only opportunity for income and belonging. Victorian society viewed crime through a moral lens. Criminals were often seen as morally corrupt, weak-willed, or sinful. This belief influenced how punishment was designed. The goal was not only to stop crime, but to deter others through fear and example. Public punishment played a key role in this system. Executions, floggings, and public humiliations were meant to send a clear message: break the law, and you will suffer. Public executions were still common at the start of the Victorian era. Crowds gathered to watch hangings, treating them as public spectacles. Vendors sold food. Children sat on shoulders, and the condemned were paraded before the public. These events were meant to terrify, but they often became grim entertainment. Over time, reformers began to argue that such spectacles hardened society rather than improving it, and that public punishment failed to reduce crime. As crime continued to rise, pressure mounted for reform. One of the most important changes came in 1829, just before Queen Victoria's reign began, with the creation of the Metropolitan Police. For the first time, London had a centralized professional police force. Officers, often called bobbies, were uniformed, paid, and trained to patrol the streets regularly. Their presence alone began to change the city's atmosphere. Crime did not disappear, but it became more visible, more recorded, and more regulated. Early police officers were not universally welcomed. Many working-class Londoners distrusted them, seeing police as tools of the wealthy used to control the poor. Officers were sometimes attacked, mocked, or ignored. It took time for policing to become accepted as a necessary part of urban life. Gradually, as crime became more organized and violent, public opinion began to shift. The police were seen less as intruders and more as protectors, though this trust was never complete. Arrests led offenders into a legal system that was rigid and intimidating. Victorian courts were formal, hierarchical places where judges held immense power. Trials were often swift, and defendants, especially the poor, rarely had legal representation. Evidence standards were inconsistent, and social class heavily influenced outcomes. A wealthy defendant might receive leniency, while a poor offender could face severe punishment for the same crime. Punishment during this period was harsh by modern standards. Theft could result in years of imprisonment, transportation to penal colonies, or even death in earlier decades. Children were not spared. Young offenders could be imprisoned alongside adults or sent to reformatories that were often little better than prisons. The belief was that strict discipline would correct behavior, even if it caused suffering. Prisons themselves were undergoing change. Earlier prisons were chaotic, overcrowded, and violent. Prisoners mixed freely, spreading disease and criminal knowledge alike. Reformers began to argue that prisons should punish through isolation and reflection, rather than brutality. This led to the development of new prison designs focused on silence, separation, and constant surveillance. The idea was that solitude would force prisoners to confront their crimes and emerge reformed. Despite these intentions, prison life remained grim. Food was scarce and bland, work was hard and repetitive, and discipline was severe. Silence was enforced for hours or even days at a time. Mental illness was common among prisoners, though rarely acknowledged or treated. For many, prison did not reform, it broke them. Crime, policing, and punishment were deeply intertwined with class. The laws of Victorian London were written primarily by and for the upper classes. Vagrancy laws criminalized homelessness. Debt could land someone in prison. Public drunkenness, loitering, and petty theft were aggressively prosecuted, while crimes committed by the wealthy, such as financial fraud, were often handled more discreetly or leniently. Yet even within this harsh system, voices of reform grew louder. Journalists, writers, and social reformers exposed the realities of crime and punishment to the public. They wrote about overcrowded prisons, unjust trials, and the conditions that pushed people into crime in the first place. These voices did not yet change everything, but they planted seeds that would later reshape the system. As the Victorian era progressed, crime became more documented, more studied, and more feared. New types of crime emerged alongside industrialization: organized theft, professional burglary, and later more complex financial crimes. The system of policing and punishment struggled to keep pace, constantly adapting but never fully resolving the deeper causes of crime. Victorian London after dark was a city transformed. As daylight faded and gas lamps flickered into life, the streets took on a different rhythm. Quieter in the wealthier districts, but restless and unpredictable in the poorer ones. Crime did not simply vanish at night. For many, it truly began then. This was the world the early police officers stepped into, armed with little more than a uniform, a whistle, and their authority. Understanding how crime and punishment worked in Victorian London means understanding the daily realities of policing before modern technology, forensic science, or reliable communication existed. The Metropolitan Police were expected to patrol their assigned beats on foot, walking the same routes night after night. Familiarity was essential. Officers learned every alley, doorway, and shortcut, as well as the faces of residents who lived and worked along their route. A good constable was observant, calm under pressure, and able to read the subtle signs of trouble: an open door where one should not be, a broken window, a group lingering too long in the shadows. There were no radios to call for backup, no cameras to record events. If something went wrong, an officer relied on his voice, his whistle, or the hope that another officer was nearby. Policing was dangerous work. Officers faced assaults, ambushes, and retaliation, particularly in areas where criminal gangs operated. Some criminals saw police as enemies, others as obstacles to be bribed or avoided. In the poorest districts, residents often distrusted the police, believing they served the interests of the wealthy rather than the community. Officers were sometimes met with silence or hostility when investigating crimes, making their job even more difficult. Yet over time, some constables earned respect by resolving disputes, protecting residents, and maintaining a visible presence. Crime itself was varied and widespread. Theft was the most common offense, ranging from petty pickpocketing to organized burglary. Pickpockets worked in pairs or groups, often using distraction techniques perfected over years. One child might bump into a victim while another slipped a hand into a pocket. Burglars studied houses carefully, learning when residents were away and how to enter quietly. Some specialized in breaking locks, others in climbing or forcing windows. Stolen goods were quickly passed to fences, middlemen who resold items through markets or secondhand shops. Violent crime was less common than theft, but more feared. Assaults often occurred in pubs, alleyways, or crowded neighborhoods, where tempers flared and alcohol flowed freely. Domestic violence was widespread but rarely treated as a serious crime unless it resulted in severe injury or death. Murder, though relatively rare, shocked the public deeply and drew intense attention from both police and newspapers. Each major case fueled fears that crime was spiraling out of control, even when statistics suggested otherwise. Investigating crime in Victorian London required patience, intuition, and local knowledge. There were no fingerprints, DNA tests, or surveillance footage. Evidence came from witness statements, physical clues, and confessions, often unreliable. Witnesses could be mistaken, biased, or afraid to speak. Physical evidence was limited to items like footprints, bloodstains, or stolen property found in a suspect's possession. Confessions were sometimes coerced through pressure or intimidation, raising serious questions about justice and fairness. The rise of newspapers transformed crime into public spectacle. Sensational reporting turned criminals into notorious figures and police investigations into ongoing dramas, followed by thousands of readers. Detailed descriptions of crimes, suspects, and trials filled daily papers. This coverage increased public fear but also pressured the police to solve cases quickly. A failure to catch a criminal, especially in high-profile cases, damaged public confidence and fueled criticism of law enforcement. One of the most significant challenges facing Victorian police was the lack of coordination. Although the Metropolitan Police provided centralized oversight, communication between officers was slow. Messages were delivered by foot or horseback. Information about suspects or crimes could take days to spread across districts. Criminals exploited these gaps, moving between neighborhoods to avoid detection. Some even crossed city boundaries, knowing police jurisdictions were limited. Once a suspect was arrested, the journey through the justice system began. Police stations served as holding areas where prisoners awaited questioning and court appearances. Conditions were basic and often uncomfortable. Suspects could be held for limited periods, but overcrowding was common. Interrogations relied heavily on questioning rather than evidence. Officers were trained to observe inconsistencies in stories and pressure suspects into admissions, sometimes crossing ethical boundaries. Courts were intimidating spaces, especially for the poor. Proceedings were formal, rapid, and often confusing to those unfamiliar with legal language. Magistrates wielded significant power, deciding whether cases would proceed to higher courts or be resolved quickly with fines or short sentences. For minor crimes, punishment could be immediate. For serious offenses, defendants faced trial before judges and juries who often shared the values and biases of the upper classes. The concept of fairness was unevenly applied. A well-dressed defendant who spoke confidently might be viewed more favorably than a poorly clothed laborer struggling to explain himself. Character witnesses played a role, but poor defendants rarely had anyone willing or able to speak on their behalf. Legal representation was costly and uncommon for working-class people, leaving many to face the system alone. Punishment reflected Victorian beliefs about discipline and deterrence. The idea was simple: make the consequences severe enough to discourage crime. Imprisonment was common, but so were fines, corporal punishment, and in earlier decades, transportation to distant colonies. Even as some reforms softened the harshest penalties, the underlying philosophy remained strict. Criminals were expected to suffer for their actions, both as retribution and as a lesson to others. Prisons, increasingly central to the punishment system, were designed to enforce control and conformity. Silence was considered essential. Prisoners marched in single file, heads down, speaking only when permitted. Work was mandatory and repetitive, breaking stones, turning treadwheels, or picking oakum. The intention was to instill discipline and reflection, but the result was often psychological damage. Isolation led to anxiety, depression, and breakdowns, though these outcomes were poorly understood at the time. Not all crimes were treated equally. Property crimes against the wealthy were punished more harshly than violence within poor communities. Laws protected goods and money with particular intensity, reflecting the priorities of those who wrote them. At the same time, crimes committed by employers, such as exploiting workers or ignoring safety standards, were rarely punished with the same severity, even when they caused injury or death. Despite the rigidity of the system, cracks began to appear. Reformers questioned whether harsh punishment truly reduced crime or merely recycled offenders through prisons. They argued that poverty, lack of education, and overcrowding were the real causes of criminal behavior. Some suggested that rehabilitation, not fear, should be the goal. These ideas were controversial and slow to gain acceptance, but they marked the beginning of a shift in thinking. The police themselves were changing as well. Training improved gradually, discipline tightened, and standards rose. Corruption, while never eliminated, became less tolerated. Officers were expected to embody respectability and restraint, reinforcing the image of the police as guardians of order rather than instruments of oppression. This transformation was uneven and incomplete, but it reshaped public perceptions over time. Crime and punishment in Victorian London were not static systems. They evolved in response to social pressure, public fear, and political debate. Each reform addressed one problem while revealing another. Policing became more organized, yet crime adapted. Punishment became less public, yet no less severe. The tension between control and compassion, order and justice, ran through every aspect of the system. As the city continued to grow, so did the complexity of crime. New forms of wrongdoing emerged alongside new methods of enforcement. The struggle between criminals and the authorities became an ongoing contest, shaped by technology, economics, and human behavior. Understanding this struggle means looking beyond laws and institutions to the lives of ordinary people caught within them. Prisons in Victorian London were designed not merely to confine the body, but to reshape the mind. By the time Queen Victoria came to the throne, imprisonment had become the central tool of punishment, replacing many of the public and physical penalties of earlier centuries. Yet while the gallows and the whipping post slowly faded from everyday use, the prison emerged as a quieter, more controlled, and often more psychologically damaging instrument of justice. To understand how crime and punishment truly worked in Victorian London, one must step inside these institutions and experience the logic that governed them. Early Victorian prisons were grim places. Many had been converted from older buildings never intended to hold large numbers of people. Cells were small, dark, and poorly ventilated. Prisoners slept on hard boards or thin straw mattresses, often sharing space with rats and insects. Clean water was limited, Sanitation was poor, and disease spread quickly. Typhus, cholera, and tuberculosis were common, and death in custody was not unusual. For many prisoners, survival itself became the primary challenge. Reformers believed that chaos inside prisons contributed to crime outside them. In earlier systems, prisoners mingled freely, sharing stories, skills, and criminal knowledge. A first-time offender might leave prison more dangerous than when they entered. To solve this, Victorian thinkers embraced the idea of separation. Isolation, they believed, would force prisoners to reflect on their crimes and emerge morally improved. From this belief came the separate system, one of the most influential and controversial prison philosophies of the era. Under the separate system, prisoners were kept in solitary confinement for most or all of their sentence. They worked alone, ate alone, and slept alone. Even during exercise or chapel services, prisoners wore hoods to prevent them from seeing one another. Silence was enforced strictly. The intention was spiritual reform, time alone with one's conscience, Bible and thoughts. In reality, many prisoners experienced intense loneliness, anxiety, and mental breakdowns. Records from the period describe hallucinations, emotional collapse, and suicide attempts, though these outcomes were often dismissed or ignored by authorities. An alternative approach, known as the silent system, allowed prisoners to work together during the day but forbade all speech. Silence was enforced through strict discipline and harsh punishment. Guards watched constantly, ready to respond to any whispered word or gesture. While this system avoided total isolation, it still placed enormous psychological strain on inmates. Human connection was denied, and communication became an act of defiance. Daily life in prison followed a rigid schedule. Prisoners woke early, often before dawn. Meals were simple and bland: bread, gruel, and occasionally vegetables or meat. Portions were intentionally small, reinforcing the idea that prison should not be comfortable. Work occupied most of the day. Tasks were deliberately repetitive and exhausting, designed less to produce useful goods and more to instill discipline. Treadwheels forced prisoners to walk endlessly without going anywhere. Oakum picking, tearing apart old rope, left hands raw and bleeding. Stone breaking served no purpose beyond punishment. Rules were absolute, and infractions were met with swift consequences. Talking, disobedience, or laziness could result in solitary confinement, reduced rations, or physical punishment. Although corporal punishment declined over the Victorian period, it did not disappear. Whippings were still used, particularly for violent offenders or those who resisted authority. Discipline was justified as necessary to maintain order and prevent rebellion. Children and young offenders were not exempt from imprisonment. Though reformatories and industrial schools were later developed, many young people still passed through adult prisons, exposed to the same harsh routines. The belief that discipline would correct behavior applied equally to children, despite growing evidence that imprisonment often hardened rather than reformed them. Some reformers argued that young offenders required education and guidance, but change came slowly. Women's prisons reflected both punishment and moral judgment. Female prisoners were often incarcerated for crimes linked to poverty, prostitution, theft, drunkenness. They were subjected to strict rules emphasizing modesty, obedience, and moral reform. Work typically involved laundry, sewing, or domestic tasks, reinforcing Victorian ideals of womanhood. Pregnant women and mothers were imprisoned as well, sometimes giving birth behind bars. Their children might remain with them briefly or be sent to workhouses, beginning a cycle of institutional life from birth. Despite the harshness of prison life, not all officials agreed on its effectiveness. Reports began to surface showing high rates of reoffending. Prison did not solve the underlying causes of crime: poverty, unemployment, overcrowding, and lack of education. Many prisoners left with fewer opportunities than before, marked by stigma and limited prospects. The system punished, but it did not heal. Outside prison walls, public attitudes toward punishment were slowly shifting. Executions moved behind closed doors, reducing their role as public spectacle. Transportation to penal colonies declined. There was growing discomfort with cruelty, even as fear of crime remained strong. Writers, journalists, and reformers documented prison conditions, exposing their realities to the wider public. Their work sparked debate about whether punishment should focus on retribution or rehabilitation. At the same time, the state expanded its reach. Prisons became more standardized, inspected, and regulated. Record-keeping improved. Prisoners were classified by offense and behavior. The system became more bureaucratic, more controlled, and more impersonal. This efficiency reduced some abuses, but also reinforced the idea that prisoners were numbers to be managed rather than individuals to be understood. For those who passed through these institutions, the experience left lasting scars. Time moved slowly. Days blended together. Silence, repetition, and isolation reshaped identities. Some prisoners emerged, determined never to return. Others, broken by the system, found themselves unable to survive outside it, and returned again and again. Prison became a revolving door rather than a final solution. Crime and punishment in Victorian London were deeply connected to ideas of morality, order, and fear. Prisons embodied these ideas in brick, iron, and routine. They reflected a society struggling to control rapid change, using discipline to impose stability. Yet beneath the rules and structures lay human lives, complex, desperate, and often misunderstood. Courtrooms in Victorian London were places where power, class, and morality converged. They were not designed to feel welcoming or fair, especially to the poor. High ceilings, elevated benches, and rigid procedures reinforced the authority of judges and the seriousness of the law. For many defendants, simply standing inside a courtroom was overwhelming. The language was formal, the rules were strict, and the outcome could alter the course of a life forever. Justice in theory was blind, but in practice, it often saw wealth, status, and respectability very clearly. Most criminal cases began in magistrates' courts. These were local courts that handled minor offenses and decided whether serious cases should proceed to higher courts. Magistrates were often middle or upper-class men, sometimes with little formal legal training. They wielded immense discretion. A defendant's appearance, speech, and perceived character could heavily influence decisions. A well-dressed, articulate person might receive a fine or warning, while a poorly clothed laborer could be sent to prison for the same offense. Proceedings were usually swift. Defendants rarely had legal representation. Lawyers were expensive, and legal aid did not exist in the way it does today. Many accused people stood alone, trying to defend themselves against charges they barely understood. Evidence was presented quickly, often based on witness testimony that could be biased, mistaken, or incomplete. The idea of innocent until proven guilty existed in principle, but in practice, suspicion alone could be enough to secure a conviction. For serious crimes, cases moved to higher courts, such as the Old Bailey. These trials attracted public attention and newspaper coverage. Courtrooms were crowded with spectators, journalists, and curious onlookers. Trials became performances as much as legal processes. Judges wore imposing robes and wigs, symbols of tradition and authority. Juries, made up entirely of men and usually drawn from property-owning classes, were expected to determine guilt or innocence, but their judgments were shaped by the values and prejudices of their time. The role of the jury was complex. In theory, it provided a safeguard against abuse of power. In reality, juries often sympathized more with victims than with defendants, especially when the accused came from the poorest districts. Crimes against property were taken particularly seriously. Stealing from a shop or employer was seen not only as a crime, but as a moral failing. Violence within families or among the poor, however, was sometimes dismissed as unfortunate but inevitable. Sentencing reflected these attitudes. Judges had wide latitude in determining punishment. They considered the crime, the defendant's past, and their perceived moral character. Repeat offenders were punished harshly, reinforcing a cycle in which poverty and prior convictions led to ever-increasing sentences. Transportation to penal colonies, once common, declined over the Victorian period, but long prison sentences filled the gap. For some offenses, particularly in earlier decades, the death penalty still loomed, though it was applied more selectively over time. Public opinion played an influential role. Newspapers reported trials in vivid detail, shaping perceptions of crime and justice. Sensational cases fueled fear and outrage, pressuring courts to appear firm and decisive. At the same time, reports of miscarriages of justice, wrongful convictions, excessive sentences sparked debate and calls for reform. The courtroom became a battleground not only for defendants, but for competing ideas about punishment, responsibility, and fairness. Women faced particular challenges in the legal system. Female defendants were judged not only for their crimes, but for their conformity to Victorian ideals of womanhood. Those accused of prostitution, theft, or drunkenness were often portrayed as morally fallen, deserving of punishment not just for breaking the law, but for violating social norms. Conversely, women who appeared modest, repentant, or respectable sometimes received leniency. Justice was deeply entangled with expectations of gender. Children, too, were processed through the courts, often with little understanding of the proceedings. Young defendants stood before magistrates and judges who believed discipline was the best teacher. While reformatories and juvenile courts emerged later in the century, many children were still tried and sentenced much like adults. Their youth might mitigate punishment, but it did not shield them from the system's harshness. The courts also played a role in reinforcing social order beyond crime. Laws against vagrancy, loitering, and public drunkenness allowed authorities to control the movement and behavior of the poor. These offenses were easy to prosecute and carried penalties that kept people cycling through courts and prisons. The legal system became a mechanism for managing poverty, rather than addressing its causes. Despite its rigidity, the Victorian legal system was not static. Gradual reforms improved procedures, evidence standards, and defendants' rights. The use of lawyers increased, jury selection evolved, and some punishments were softened. Yet progress was uneven. Old attitudes lingered, and the gap between law in theory and law in practice remained wide. For those who passed through the courts, the experience was often confusing and frightening. Decisions were made quickly, lives altered in minutes. The system valued order and authority above understanding or compassion. It was efficient, powerful, and deeply flawed, reflecting a society struggling to balance control with justice in an age of rapid change. For many offenders in Victorian London, sentencing was not the end of the ordeal. It was the beginning of a long and uncertain struggle to survive the consequences of punishment. Once a judge delivered a sentence, the individual's future followed one of several paths: imprisonment, transportation in earlier decades, hard labor, or eventual release back into society. Each path carried its own hardships, and none offered an easy return to ordinary life. Transportation, though declining during Queen Victoria's reign, still cast a long shadow over the justice system. For decades, convicts had been sent thousands of miles away to penal colonies such as Australia. The punishment was severe not only because of the labor involved, but because it severed all ties to home. Families were torn apart permanently. For those sentenced to transportation, London vanished behind them, often forever. Although the practice gradually ended by the mid-19th century, its legacy lingered in public fear and memory, shaping how people understood punishment and exile. For prisoners who served time and were released, freedom was fragile. A criminal record followed them everywhere, though it was not formalized in modern terms. Employers were reluctant to hire former prisoners, landlords refused housing, and communities treated them with suspicion. Even minor convictions could permanently mark a person as untrustworthy. Without work or shelter, many former prisoners drifted back into poverty, the very condition that had led them into crime in the first place. The stigma of imprisonment was especially harsh in Victorian society, which valued respectability above almost everything else. A single conviction could destroy a reputation beyond repair. This was particularly devastating for working-class individuals whose survival depended on daily labor and community trust. A man released from prison might find every door closed to him. A woman, especially one convicted of theft or prostitution, faced social exile that left few alternatives outside crime or the workhouse. Charitable organizations attempted to address this problem. Some reformers believed that rehabilitation required support, not just punishment. Prison aid societies emerged, offering basic assistance, temporary lodging, food, sometimes help finding employment. Religious groups emphasized repentance and moral reform, hoping to guide former offenders toward respectable lives. These efforts helped some, but resources were limited, and the scale of need far exceeded what charity could provide. Life after prison was further complicated by the conditions inside prisons themselves. Many prisoners emerged, physically weakened and mentally scarred. Years of silence, isolation, and monotonous labor left lasting effects. Some struggled with anxiety, depression, or an inability to function independently. The system expected them to reintegrate smoothly, yet offered little preparation or support. Failure was often interpreted as proof that the individual was beyond redemption, reinforcing harsh attitudes. Women faced distinct challenges upon release. Female prisoners were often sent back into the same environments that had led to their arrest: poverty, exploitation, unstable housing. Employment opportunities for women were already limited, and a criminal past narrowed them further. Domestic service was one of the few options available, but employers demanded spotless reputations. Many women found themselves trapped between social expectations and economic reality, with little room to rebuild their lives. Children released from reformatories or prisons encountered similar obstacles. Though reformers argued that youth could be redirected, society offered few opportunities for young offenders to start anew. Many returned to overcrowded homes or the streets, carrying the weight of institutional life into adulthood. The cycle of arrest, punishment, and release often repeated, not because of inherent criminality, but because of structural neglect. The workhouse loomed as an alternative for those who could not survive independently. For former prisoners, it was both refuge and threat. Entering a workhouse meant food and shelter, but at the cost of freedom and dignity. Families were separated, labor was compulsory, and conditions were harsh. For many, the workhouse felt like another form of imprisonment, reinforcing the sense that once marked by the system, escape was nearly impossible. Public attitudes toward former criminals were shaped by fear and moral judgment. Newspapers rarely followed up on what happened after sentencing. Stories ended at conviction, leaving the public with an image of crime neatly resolved. The reality, that punishment often failed to reduce crime and instead perpetuated suffering, remained largely hidden. Reformers continued to argue that without addressing poverty, education, and housing, punishment alone could never create safety or justice. Over time, some changes began to take hold. Discussions about probation, conditional release, and rehabilitation gained momentum toward the end of the Victorian era. The idea that society shared responsibility for crime, not just individuals, slowly entered public debate. These ideas did not yet transform the system, but they challenged the belief that punishment alone was enough. For the people living through it, however, the system remained unforgiving. Crime and punishment in Victorian London extended far beyond arrest and sentencing. They shaped entire lives, families, and neighborhoods. The law did not simply punish acts. It defined who could belong and who would remain forever on the margins. Some crimes in Victorian London did more than fill court records. They unsettled the entire city. These were the cases that haunted newspapers, fueled rumors, and reshaped public fear. While theft and assault were everyday realities, certain crimes pierced the Victorian sense of order so deeply that they became symbols of everything dangerous and uncontrollable about urban life. These infamous cases revealed not only the brutality of crime, but also the limitations of policing, the fragility of justice, and the anxieties of a rapidly changing society. Murder was the crime Victorians feared most, not because it was common, but because it shattered the illusion that the city could be controlled. When a body was discovered, especially in a poor district, panic spread quickly. Streets filled with gossip, suspicion, and dread. Neighbors eyed one another warily. Police investigations drew crowds, and newspapers rushed to publish every detail, accurate or not. Each murder became a public event, followed obsessively by readers across social classes. The most notorious crimes often occurred in the poorest neighborhoods, where overcrowding and poverty already bred anxiety. Narrow streets, dim lighting, and transient populations made these areas difficult to police and easy to fear. When violence struck, it confirmed middle-class fears about slums as places of moral decay. At the same time, it intensified pressure on the police to demonstrate competence and authority. Investigations into major crimes exposed the weaknesses of Victorian policing. Without forensic science, detectives relied on witness testimony, circumstantial evidence, and intuition. Mistakes were common. Suspects were arrested on flimsy evidence, interrogated aggressively, and sometimes convicted despite doubts. When crimes went unsolved, public confidence eroded. The idea that criminals could vanish into the city terrified Victorians, who increasingly saw London as too large, too complex, and too anonymous to control. Newspapers played a central role in shaping this fear. Sensational headlines transformed criminals into monsters and detectives into heroes or failures. Detailed descriptions of crime scenes, victims, and suspects blurred the line between reporting and storytelling. Readers followed investigations as serialized dramas, speculating about motives and identities. This coverage increased pressure on police to act decisively, sometimes at the expense of careful justice. These infamous cases also influenced public attitudes toward punishment. Calls for harsher sentences grew louder after shocking crimes. Some argued that leniency encouraged lawlessness, while others insisted that brutality failed to prevent violence. Each high-profile case reignited debates about deterrence, rehabilitation, and the purpose of punishment. The justice system was constantly pulled between fear-driven demands for severity and reform-driven calls for humanity. Fear of crime affected everyday behavior. People avoided certain streets, altered routines, and locked doors more carefully. Women, in particular, were warned to stay vigilant, reinforcing gendered ideas about vulnerability and danger. The city's geography became moralized. Some areas were seen as respectable, others as inherently criminal. This division deepened social distance and justified unequal treatment by police and courts. Infamous crimes also revealed how deeply class influenced justice. When victims were wealthy or respectable, investigations were thorough and highly publicized. When victims were poor, attention faded more quickly. Crimes against marginalized people, especially women, the homeless, or immigrants, were often minimized or forgotten. Justice was not equally urgent for all, reinforcing the sense that the law served some lives more than others. Despite fear and sensationalism, these cases sometimes sparked reform. Public outrage over investigative failures led to improvements in policing methods. Record-keeping became more systematic. Detective work gained status and structure. Slowly, the idea emerged that understanding crime required studying patterns, environments, and motives, not just punishing offenders. These shifts marked early steps toward modern criminology. Yet, even as methods improved, fear remained a powerful force. Crime stories became part of Victorian culture, shaping literature, conversation, and identity. They reflected deeper anxieties about urbanization, anonymity, and social change. Criminals were seen not just as individuals, but as symbols of a city struggling to contain itself. For ordinary Londoners, these infamous cases were reminders that crime and punishment were not distant systems. They were forces that could reach into any home, any street, any life. The justice system, with all its authority, could not guarantee safety or fairness. It could only respond, often imperfectly, to the consequences of deeper social problems. As the Victorian era moved toward its end, the balance between fear and reform continued to shift. Crime did not disappear, but the ways it was understood began to change. The focus slowly expanded, from punishment alone to prevention, from spectacle to study, from moral judgment to social responsibility. As we come to the end of this long journey through crime and punishment in Victorian London, it becomes clear that the system was never just about law-breaking and discipline. It was a reflection of a society struggling to manage rapid change, overwhelming growth, and deep inequality. The streets, courts, prisons, and police stations of Victorian London formed a vast mechanism designed to impose order on a city that often felt uncontrollable. Yet beneath that mechanism were human lives, fragile, complex, and shaped as much by circumstance as by choice. Victorian crime was inseparable from poverty. Overcrowded housing, insecure work, hunger, and lack of education created conditions where crime became, for many, a means of survival. The justice system rarely addressed these root causes. Instead, it responded with punishment, believing that fear and discipline would preserve order. Policing grew more professional, courts more structured, and prisons more systematic. But the underlying philosophy remained focused on control rather than understanding. The creation of a modern police force marked a turning point. Regular patrols, uniforms, and centralized authority reshaped how London functioned. Crime became something to be monitored, recorded, and managed. This brought greater consistency, but also expanded the state's power over everyday life. The police became symbols of order, yet also reminders of surveillance and authority, especially in poor communities where trust remained fragile. Prisons, too, evolved into institutions of routine and isolation. They were meant to reform, but often punished without healing. Silence, separation, and labor were imposed in the belief that they would correct moral failure. Instead, many prisoners left more damaged than before, unprepared for life outside, and marked by stigma that followed them everywhere. Release did not mean freedom. It meant survival in a society unwilling to forgive. Courts reinforced social hierarchies. Justice was shaped by class, gender, and respectability. The same act could lead to different outcomes depending on who committed it and how they were perceived. Law promised fairness, but practice delivered something uneven and often harsh. Yet within this system, debates grew louder. Reformers questioned cruelty, journalists exposed abuses, and public opinion slowly shifted. Infamous crimes intensified fear, but also forced reflection. They revealed the limits of punishment and the impossibility of absolute control. Each unsolved case, each wrongful conviction, chipped away at confidence in the system. Gradually, the idea emerged that crime could not be solved by punishment alone, that prevention, education, and social reform mattered just as much. By the end of the Victorian era, the foundations of the modern justice system were in place. Policing, prisons, and courts had become permanent features of urban life. Their flaws were evident, but so was their influence. The debates that began in Victorian London about punishment versus rehabilitation, authority versus fairness, fear versus compassion, continue today. Looking back, crime and punishment in Victorian London teach us that justice is never static. It is shaped by values, power, and the willingness to see people not just as offenders, but as products of their environment. The Victorian system sought order above all else. In doing so, it left behind lessons written in stone walls, iron bars, and quiet suffering. Lessons that still echo in the systems we live with now. And now, as the gaslights fade and the city grows quiet once more, our story reaches its end. Good night, and may these slow reflections on history ease your thoughts and guide you gently into rest.